Hey, I just got back from my pre-op appointment and I went into it pretty confident I knew what was going on with it. Usually in the past with all of mine before, they've taken a blood test, they've done another pre-health interview on me. They give me the instructions on, no eating or drinking after midnight, and then they give you the time that you need to arrive in the office the next morning. Usually it's around 6 o'clock in the morning. And so I would walk out and have my day. That's not how this one went. All of it. When I checked in for my appointment, the person who was checking me in to see the pre-op nurse let me know that my surgery is scheduled at noon. That's not a good time. The reason for that is that there is no eating or drinking after midnight. So I'm going to be sitting around for 12 hours starving before I even get into surgery. Besides that, that's 12 hours that I will be dehydrated, which is a problem for somebody like me. I am a needle phobe. I'm not necessarily afraid of the pain or the blood or the stick, or all of that is fine. I have a completely irrational fear, though, of something being tucked into my skin. So they are going to get two chances at starting my IV. The third time, I'm really going to have a hard time. I will be bawling my eyes out. I go into shock. I have collapsed my own veins. I have collapsed my own veins on my way into surgery. I went ahead and I brought these concerns up to my nurse, and the nurse that was seeing me for the pre-op, and I explained all of that to her, and she said, "Oh, well, yeah, no, we want you to be well hydrated. That'll be fine. Hey, look, you can eat or you can drink anything up to 4 hours before you have surgery, so long as it's coffee without any, like black coffee, plain unsweetened tea, and water. I am just going to be pushing water because my concern is not flavor. My concern is making sure that these babies stay very well hydrated, and they're very easy to see and find and stick, because I'm not kidding, it's two. Other than that, I had my pre-op appointment at the same time with the anesthesiologist. I went over all my medications again, told them I was fine with my anesthesiology. In the past, I've never had any trouble. Hey, by the way, not taking any narcotics and opiates, not going to take any narcotics or opiates. And while I was at it, I slipped in the same thing as far as, my surgery's not until noon. I'm kind of uncomfortable about being dehydrated all this time. But the nurse mentioned I could drink water until 8 o'clock in the morning. Is that okay? And she said the same thing. She verified it. Absolutely. Please do. It'll make you easier to, stick the line in. And that's all I wanted to hear. Besides that, they gave me some body wash to wash with tonight, and then tomorrow morning, it is an effort to prevent surgery site infections, which is something I haven't had before. I was never even part of my treatment or my, pre-surgical routine before. But before I came and videotaped this, I went ahead and I did a little research on Google. And as I'm recording this in 2023, the CDC is saying that surgical site infections are one of the top 4 hospital-related infections that you can obtain. Like right behind urinary tract infections and a little bit before miscellaneous catheter insertions. So, hey, good to know. Basically, we're talking staph infections. We're talking other skin infections. Sometimes people talk about the flesh-eating bacteria. Okay, things like that. That I will be particularly prone to because A, I'm being cut open, and parts of my body that are not used to being exposed to the outside will suddenly be exposed. But besides that, the surgical process itself would impair my immune system slightly. My age could play a factor in that. Any of a number of things. Just the stress on your body would do that for you. So plus, I'm going to be in a hospital. People don't usually go to the hospital that don't have anything wrong with them. And so that's definitely another thing to keep in mind. I'm literally going into Infection Central. So I got a wash to use. They gave me an Exine. No, they didn't. They gave me Technicare soap. But there's an Exine scrub I hear that's out there. Some of them are available at the pharmacy. St. Francis just handed me a bottle. And they gave me instructions on how to use it. I'm supposed to wash up tonight as normal, and then take this body wash and scrub everything from here down to my toes, minus the private parts. Let it sit on my body for about 2 minutes and then wash it off. Just rinse it off. I'm sorry, not wash. No more anything is going to touch my body after that. I'm not supposed to use lotions. I'm not supposed to use deodorants. I'm just supposed to climb into a pair of clean pajamas, which is a problem for me. I never wear dirty pajamas. But anyway, then climb into a clean, fresh pair of sheets and go to bed. And in the morning, I get up, I use the body wash all over again, scrub from here down, and I have to do it before 5 o'clock in the morning because it apparently has to take time to dry on your skin. So yay, if I was going to miss out on being up at 6 o'clock in the morning for my surgery, now I still get to get up. Yay. Anyway, on top of that, they do recommend if you want to avoid or try to prevent as many surgical site infections as possible, not to shave for 48 hours before surgery. I cut it super close. Had I not been running a little bit late this morning and just had to throw on my clothes and run out the door and, skip the shave, I would have been in trouble. So you definitely want to make sure you're watching that. On top of that, they want to make sure that you don't have any cuts on your fingers, any kind of wounds anywhere, fresh piercings. They don't want you to have those. After or tomorrow morning when I get up, I'm going to have no earrings in by then. I don't have any dentures or appliances or anything, but if you did, those should be taken out. Any piercings anywhere, go. My wedding ring is going to be staying home, along with most of my valuables. I'll take my wallet with me with my ID, and I'm going to hand that over to my husband, and he gets to be my purse for the day. That's all right. He's used to it. I do it to him all the time. Anyway, besides that, I get to just spend the rest of the night, washing and then relaxing. And as of midnight, I am not going to have anything except for just water until tomorrow morning at 8. And then it's showtime. So here's to it. And we'll see how it goes. Talk to you later. Bye.